Tonight, we're going to do something a little bit different, and we've been building up to this. The occlusion studies we've been doing, the posture studies, they're all going to come to a fore now with tonight's message, so to speak. What we're going to look at, we're going to look at two cases. One, we're going to look at a case where we're going to do a full arch implant immediate, so to speak. Now, we can also use that lesson to be able to, if let's say you've already placed your implants and they've been integrated for X amount of months and they're ready to go, it's the same thing, but we're going to walk you through this protocol because it'll actually show you two protocols in one. Then the second thing we're going to do is we're going to look at a locator style implant overdenture restoration and what scanning technologies are out there to actually scan those as well. Now, I guess there's some fear and trepidation about scanning, and typically that comes down to, is it accurate enough? If I go from left to right on an arch, am I losing so much clarity and quality of that scan every time I click that when I put that bar down, is it going to be rocking? And that's fair concerns. And the technology is certainly rapidly evolving, but we're coming so far. It's not about going from an automobile to a Tesla. It's about moving from a horse really to a Tesla, so to speak. So it's a whole quantum leap. And so tonight we'll talk a few things, a little bit about the full arch systems that are available on the market to do digitally. There's a photogrammetry. Now, you may have all heard of photogrammetry. There's the PIC cameras, the iCAD 4D cameras. Now, the way that technology works is you put some reference points into that patient's mouth, and then you take a step back. You've got your camera, so it's a very expensive camera, and you're taking photos, and you're actually capturing that information, that implant information, all at once. But before you've done that, you've done a pre-scan. So an intraoral scanner features prominently in that workflow as well. But then you've got the old school way, right? Which is tried and true. Let's not disrespect the old school, because it's a fantastic system where you put your impression analogs, you wire it all together, you composite it all together, and take your impression, and it still works fantastically as well. But what we want to look at tonight is how do we scan? Now, you may have done implant workflows before, single tooth implants, and you place your vertical scan body into the implant and you scan that. Now, why is full arch so scary? The reason for that is, let's say you've got 4 implants. In between each of those implants, there's a lot of moving parts. You know, if it's on a lower, there could be the tongue rolling over, mucosa, lots of saliva. It's just, there's a myriad of reasons why that's a tricky scan to get and why you could get some discrepancies. But what we need to look at tonight is there a way that we can use that intraoral scanner effectively and go from go to woe, start to finish, and with the scanner? So that's what we're going to look at tonight. There are some systems out there. We want to look at one system that I've been involved with and have a chat about some of how the technology works, and that'll explain a lot. So I actually hate death by PowerPoint, but I have to put up 3 slides. I apologize. Just to illustrate some of the shapes, because we're going to be doing a lot of work here down in the mouth, real life patient, so to speak, with a mannequin with extractable teeth, by the way. And so I just want to show you a few of the shapes and some of the little bits and pieces before we really jump into it. So there's a couple of horizontal, so to speak, scanning systems out there. Now, the reason these are so effective with intraoral scanning is that you're building a solid bridge right across the arch. So you've got your implants placed all over the place with gaps in between, but you're actually rotating these battleships, so to speak, into an alignment so that when you scan, you've just got like a really nice bridge to walk across, and then you've got quite good accuracy. This is a similar sort of system. Now, the system that I'm going to show you tonight on the live mannequin patient is a system called Tectonic. Now, this system goes a little bit further than that. It does embrace coming close together, bridging, but it goes a little bit step further, because what we wanted to do is we want to actually verify the scan on the spot. Because as you know, you can scan, then the lab will send you back a milled verification jig. You place that on, okay, cool, my scan was good. But we actually want to get some peace of mind right at the start. So this system, I think, is world beating in that respect. Let's have a look at it. Some of the little characteristics are there's a head to toe trough. Now, when you're scanning big scan bodies like this, and this is something that a couple of my mates here tonight, we've struggled with over years, you need a trough from top to bottom that links the body of the scan body to the collar. Otherwise, it's very difficult to rotate that scan head underneath to link the collar and the head together. So this system has a head to trough system. We bond these together, and again, I'll show you this in a moment, but one thing that's great about this system is it has a guttering system. So when you apply your composite, your flowable composite to the 2 scan bodies that are next to each other, it really flows well and it holds really nicely. There's an additional redundancy built into this system as well. And there's actually resin holes. So the resin, well, the composite will actually go down into the holes, fill the guttering system, and then really grab tight. You've got saliva, you've got blood everywhere. This is just you've got a mechanic. So you've got the appliance is actually made out of a PMMA. It's a milled PMMA with a metallic collar at the bottom. But what that does is it just allows that additional mechanical security in addition to the chemical bond that you're going to get from the plastics. The other thing is interesting about this weird shapes, you'll see these weird shapes, is they have a heptagonal design. That's intentional as well. If we were to go with a hexagonal design, if you rotate a hexagon, it's the same anyway. But a heptagon with 7 sides, it's unique. And so when the lab gets your scan, they bring it into their system, hopefully using a 3-shape system in your lab. Hey, Joe. But when you get that, sometimes you're trying to work out what direction does this go? And so your lab technician will love you because it's a heptagonal shape. That means that the alignment and the rotation, you can always work out where it is. It's actually a really nice little thing. So that's and then there's another little point there on top where we have some dots in the top of the head of the scan body. So the lab again can relocate things very effectively. There you go. One thing I've found with long span scanning is every mouth is different, and you all know this. You know, you could have really steep retromolar pads. You could have all sorts of things happening in the anatomy. And so if you had just a single straight horizontal shape, sometimes it doesn't work for the anatomy that you're working with. And so this system's fantastic in that it has a shape for every situation, every instance that you're in. And so you've got a propeller shape, and that's really good for the maxilla. You can rotate it anyway, because you really need to get that scan craft as close as possible to the next scan craft. And so you need to select the parts that are going to rotate and get yourself into a nice little jigsaw puzzle. Then you've got the Mickey Mouse. Mickey Mouse and the singles are probably the most common, especially with the anterior implants that you're placing. You might put 4 in the middle there, and the singles are quite good for that. Then you've got a long span. The long spans are really great as well, because you could have 4 anterior implants, and you might have 2 implants posteriorly that are quite far away. You can use a long span to reach down the back there. And then you've got an inclination piece. So that's when you've got implants down, again, posteriorly, and you might have a hamular notch that flips down like that, or a retromolar pad that flips up like this. The inclination has a degree of angle there so that it misses that. What you don't want is you don't want to impinge on any of the mucosa. And so that defeats that challenge as well, and still allows you to put this all together. The other thing we're going to talk tonight, and again, I just want to really quickly show you this, is there is an implant overdenture system for Tectonic as well. And so it pretty much just, it acts as an impression analog. So for locators, for the Novalock system, it's compatible with both of those as well. And we'll look at that workflow. There's a little bit of difference in the body shape. It's just a flat shape because the locators are coming up out of the ground, so to speak. And so you wouldn't want to have a big high collar on those, otherwise you'll be mountains in the air. The only thing this thing doesn't do is if we bond it all together, put a bit of wax and take a bite as well. I don't know, maybe you could. But then how do you get the screw holes, right? So you've got long span arms, and we'll just keep moving through here. One really cool thing that's coming out as well is an AI proposal. So what you can do as well, and this is something that the guys are working on, is you can do a pre-scan of your implant positions straight over the top of your healing caps, send that off to Tectonic Lab through your Trios portal. They will get that, and AI will pick up that 3D model. It'll automatically see the position of the healing caps. It will then send you back instantly on email a proposal, so you can figure out what parts to use. So until you start to get your head around the system, what parts I'll use where, you'll get a little proposal like that will come back. And again, that's not ready yet, but that's something that I've been told is in the WIMS as well. So that's the system that we're going to look at tonight. We're going to do it in live cases specifically. So let's get straight into it, right? Here's our case. Our case is a lower arch. So we've gone into surgery, patients potentially in IV. We'll go IV, Johnny, you reckon? IV? It's done under IV. You've already extracted 4-1, 4-2, 3-1, and 3-2. They're all gone, right? You've just moved really quickly through it. You've placed your 2 anterior implants. And what do you do now? Okay, so this is when you got to screw things together and start moving on this. So that's what I've done. We've extracted those teeth. We're going to place them. Now, we're actually going to place 4 implants in this one. You might be able to place 6, but for this story, we're going to go with 4. And So what we're going to do, first thing I'm going to do is I'm going to place that. Now I've already done the opposing. So I've done the opposing arch. I'm going to pull up my trios now. And I'm going to scan my lower. So I've screwed in. So we placed our multi-units. These are actually neodent implants. We placed our neodent implants. And I've placed the Tectonics that are compatible with all major implant companies as well, by the way. Now I've placed them here. Can we just get a bit of a look? I'm gonna walk out of screen for a bit. Is that okay? If you go look here, you can see that I've placed the Tectonics. This is for our live audience, quite closely, but not exactly together. Can you see that? So the two center pieces there. So I've been strategic with it. Now with this workflow, this is what we're going to do. We've done our extractions. We've placed our multi-units. We've placed our scan bodies. We're now going to bond this together. So I'm going to use my gutters. Now the home audience can see us because we're up there. I'm going to put some flowable resin into the guttering system. It sounds a bit weird, doesn't it? Clear the gutters out, not fill the gutters up. We're filling the gutters up this time. And put that all together. Then I'm going to grab my curing light. I'll go like that. I forgot something tonight. Don't look at it. Go on 20 seconds. You can go shorter. That'd probably do us. Any flowable is fine. Doesn't really matter which one. Okay, now we're going to unscrew this because what we want to do now. I don't want to put anyone on the spot. We're all friends. I'm friends with every single person here. Well, I don't know everyone on air, but everyone here in the live audience, I'm going to pick on you. I'm going to call for a left-handed dentist. Now, it's not for any reason. It's not for any reason. Now, I don't know if there's any. Well, I know there's a left-handed denture guy there. Now, what I'm doing is I'm unscrewing the Tectonics that are bonded together. Now, this is the cool part of this system, because let's say we hadn't bonded them together. How would we have known to put them back on? My apologies. We need to scan it, don't we? Look at me. But I am going to get a volunteer. I am going to get a volunteer. Well, it goes back on. Garth, you are left-handed, aren't you? Yeah. Okay. Now the reason I'm asking for a left-hander, it's a very specific reason, because I need someone. I don't know how to extract teeth, and I need to do a full clearance. But before I do, I'm going to scan this. Sorry, Garth. You know I love you, right? Dr. Garth and I, we've been friends for many years. Now, I'm not going to really take a whole lot of time with this scan, guys. I'm just going to quickly throw this together. We don't want to waste everybody's time. We want a really quick session, but I am going to take a bit of care with the buckle because we need to relocate the bite. We have a camera, do we? Now, the nice thing about PMMA over titanium scan bodies is we can, it's very easy to scan. So the shine factor is quite low, and they are they're disposable as well. So they're much cheaper to buy. You don't have to spend thousands of dollars on a kit. All right, and again, I'm not going to spend a whole heap of time on this. I'm just going to throw that together there. Okay, cool. So now we've scanned that. The next thing I'm going to do is I'm going to take a bite. I'm going to take a bite. I have my opposing already scanned into the system. We've selected our bite option. I'm going to do a hand articulation here. We do have an upper. Now, this is funny. This patient is our graphic designer. She was kind enough to give us a cone beam and an intraoral scan, and we were able to put together a 3D printed extractable tooth case for her. Let's just quickly record this bite. Now, the series is called I Cross the Line, and what's the reason we call it that? Because we go across the midline when we do our full arch scanning. And we then, again, well, the patient's mouth typically is the bite relocated straight away. So now we've done our bites. Now in this immediate case, okay, Garth, come on up. I'm going to unscrew this. I'm going to ask Garth to clear the lower arch now, because we've got a bite. So we have our bite because I've already done the opposing. I've bonded these two together. I'm going to unscrew them now, and I've done a scan in the bite position. Now, what happens when it gets to the lab? The lab guys pick up all these files and they just start putting stuff on top of each other in perfect alignment. And so the more information we give them, the more accurate the appliance is going to be. So that's the rationale behind this. So let's take this apart. What's your, now I know you lie guys back, right, for extractions? Sadistic people. But we're going to let you, this patient stay, it's probably not going to be pretty.
Left-handers can do anything.
Okay, fair enough. fair enough, and that's true. I'm just going to undo this. Okay, so we're taking our Tectonics out. Garth, can you extract those teeth for me, please? Finish them off. I'll take these ones because I've pre-extracted the 5s. I'll take those ones out. And can you finish him off for me? While he's doing that, does that make sense? So why are we leaving the teeth in position? Why are we doing that? Oh, no one knows? The reason we're doing that is because we need to take a bite. So we could have cleared them out. And this is in an immediate context, don't forget. Oh, there you go. Thanks, Garth. That's a bit quicker than that. Yeah, that could go. Poor guy. He's not used to standing them up. So that's the critical nature of this process. Well, the fantastic nature of it is that this is already bonded now. And what we can then do is put that back in exactly the same spot. So when we do our full arch scan, we'll then choose some Mickey Mouse shaped scan body. Oh, you're doing good, Garth. You break any roots yet?
Not yet.
Did you hit the mental foramen? Got no. Got no sensation. So what we can do is this is just, there you go. There's one. That's good. It's all on the chair angle. This is live TV, right? So we'll just get those last teeth taken out. You're good there? You should just try to be careful. Jeez. You're gonna have to go surgical. We didn't bring a surgical motor for him. Well, we got a laughing. There you go. There's a beautiful molar. So what we're going to do is we're now going to put the multi-unit straight back in on top of those, and we're going to place our other posterior scan bodies, and then we're going to bond that together. And we're going to scan that as well. And so that way you've got a bite, you've got your pre-scan, and thank you very much. Oh, well, there you go. That's pretty fun. Very good. Thank you. I'm going to place the fastest multi-unit you've ever seen go in. Okay. So now we've placed our posterior implants. All right, we're just speeding through this. Is that impressive? That's impressive. We placed our multi-units into position. What we're going to do now is we're going to pop back our anterior scan bodies. So we're going to put those back on. The Tectonics go straight back on. And I'm destined to lose a screw. It's going to happen, but I've got spares. Okay, so we're putting that back together again now. Does anyone have a look? Quick look. So now we've cleared it out. He broke a few roots. Look, that's Garth. He breaks roots. So we've placed our multi-units now again. Now again, we have no gingiva on this as well, but that's a model that we need to create. Kevin, there's one for you. So basically, we're ready to do our posterior scan. So we'll put that back in position. You guys saw that as well. So you got your sockets there. Really, we should have done a guided surgery. We've done the whole shebang. We'll put that back on. We've got our multi-units. So now I'm going to pick up the Mickey Mouse shaped ones like that. Now I like the Mickey Mouse shape because you can they're bidirectional. So you can angle it to the front and come really close to those anterior ones. And then if you've got something behind it, you can then connect on again to that as well. This scan system is not dependent upon the heptagonal wings. That's what I like about it. It's actually a vertical scan body. So the relocation points that happen in the lab are not the wings. It's actually the head, the heptagonal head. Talking too much. Let's get this one on. I do have a screw there. This is going to work well. Screwing this one in. It's like a cooking show. You got to keep talking while you're doing things, right? All right. It's a webinar like no other. Okay, so we've got those 4 on now. So what I'm going to do now, while I was doing this, technically speaking, we're going to open up a new patient file. This is already push sent. I've sent that off to the laboratory, whichever laboratory you guys use. It's gone off in file 1. Now we're going to set up patient file 2. I'm going to skip the post-processing because we just want to move through this quickly. And I'm going to set up a new case under that same patient file, not a whole new patient, just a new case. And we're going to go again with that same patient. We're not going to do it. We don't need the bite because the bite's already been done with the first scan. You follow me? So your initial anterior scan now will be the thing that your lab puts over the top when you put the 4 implants and scan that. You with me? So it's all about overlays. Overlays the key to this. Okay, so talking too much. Let's get this next case up and running. While that's opening up. And you do scan only on these guys. So full arch work is always scan only. You also have another option where you can actually scan left to right. So if you want to do a digital verification in addition to the Tectonic verification, You'll scan left to right, then you'll scan open up, and so you'll do that with a lower, then you'll open the upper and you'll scan right to left. The lab will then do another verification of those two scans and ensure that that's got perfect digital accuracy. And so that's why it's really good. The 3Shape system is really, really nice to work with. Let's open that up. While that's opening, I'll just quickly bond these together. It's quite a big height differential in my, you can tell I don't place implants. Should have got you to do this too, Garth. Poor Garth. Just going to cure that. Okay. Again, I'm shooting. It's amazing, isn't it? The only thing you forget, you walk on air and you've forgotten that thing. I'm going to put one more in there because I bumped it as I went. And while I do that, I'll just quickly bond the other posterior one in there as well. And this is where I like the guttering system and the holes because it really holds it all together. Sorry, home audience, you're looking at my hand at the moment. Just cure the other side. It's like watching grass grow. All right. Okay, now we're going to do our scan. So, like I said, you can do this in two ways. One, you can just do one scan, send that bonded bridge, so to speak, bonded scan craft together, send that to your lab. They'll use that as a verification. And if you want to go super duper into absolute verification, you can do a left to right scan, which I'm going to do now. Then you can also select your upper and do a right to left scan, and then they'll do an overlay of that as well. And you'll have impeccable readings with that. So let's just quickly throw this one in. Now, when you're doing a pre-scan, now if we weren't doing a full arch immediate like this, your pre-scan is actually a really important step, and you need to gather as much, that's the way we should use here. You need to get as much mucosa as you can in your pre-scan. So you don't actually, you scan with your healing caps on. You scan with your healing caps on, and then that's your pre-scan. But you want to get as much information as physically possible. Now, again, I'm not going to go through and scan the hell out of this. We're just going to do a quick one here. I'm just gathering. Now, what the main thing you want to do, now, we talked about this in our little slide presentation, is we want to make sure that we link the scan body to the collar, the X-rayable collar, to the body proper. And the reason we want to do that is so that we can now put this patient into an OPG and verify that our scan bodies are all seated. That's pretty important. Should I let you up here, Richard? I've got the world's best scanner in the room, and I'm scanning them all. Thanks to 3Shape guys for coming down tonight. And again, you can still see all those sockets, but again, you would have stitched him up, probably grafted as well here and whatnot. All right, we'll go with that. So there's our system. So the last thing we'll do then is unscrew everything. Again, send your digital files through. You can go do an upper and then do a left and right as well, or right to left if you wanted to do that as well. Let's get into the denture stuff. The last case we're going to talk about is a fully edentulous lower case. 2 implants are placed with removable abutments, so to speak. I want to be agnostic with the systems, but we basically, what's the option here? So our typical option here is you click on your impression analogs, you cut some holes in a tray, you take an impression, you pull it out, and you then go through the normal analog steps. With this system, however, we have the option of actually doing a scanned, start to finish scan, so to speak. I'm going to just open up another patient file real quickly. I'm going to skip that post-processing because we'll be waiting for a while. I'm going to show you. So first, I'll show you the step from start to finish. Oh, open up our other one. Sorry, guys, we'll just open up our other scan. They're both called Tina. Okay. So we'll open up a scan. Now, the first thing we're going to do is our pre-scan. Remember what I said about pre-scan? It's all about overlaying files. So our pre-scan has got to produce as much landmark as possible, right down into the mylohyoid ridge, retromolar pads. Get as much anatomy as you physically can, because you're going to need it when the lab's going to need it. So we want to make the lab's job as easy as possible so they can give us the best possible work. So the more landmarks we give, the better it is to overlay the scans. And so we'll just do a quick run around here. Now, this is not like a patient's mouth because there's no saliva, there's no tongue, all the stuff that makes our life really hard, none of it's there, but it's very good for this demonstration process. That's what we need to do. We need to invent a mouth with a tongue that moves and produces saliva so we can really make our scanning hard. But this is quite nice to be able to do this on a chair, because typically when we're doing scan training, we're like this, right? It's not realistic, but at least we're on a dental chair, and we're able to actually really at least feel posture-wise what we're doing. I'm just going to run around and grab as much info as we can. So stop there. Now, I've done a lower, so I've selected a lower scan file. The upper scan file is going to be used for my scan body scan. Let's click that one. Now, these little things, we saw them on the PowerPoint a bit earlier. They basically have a system that clicks straight onto the whatever system, a Novalock system or a locator system that you're using. Now, like I said, this is a 3-3 and a 4-3 implant placement, and that's very common for the two implants on an implant overdenture. Very, very common. Probably the most common places, best bone. And so it's quite a span, it's quite a distance to come across. So I would always pick probably the long span option for this. It'll just get me the whole way there. So I just click those into position. They really click on quite nicely, and you can feel they're quite engaged. I'll click that in there. So I'm going to pull this off, and I'm going to show everybody here as well. I'll show you the home guys, and I'll show you guys as well. So you can see here, I'm just sort of rotating them there so you can all see. I'm trying to get it as close as possible so that the gutters are lined up. Not touching, but as close as possible, as you guys can see there as well. Probably should have showed you the other one as well. We can talk about it after. So for this system, we want to get as close as we can to each other without touching, because we want to have a bond between the two. What we then do is, you can do two ways, by the way. You can actually scan, then bond, or you can bond, then scan. It doesn't actually matter. Either way, like I said, this is not a horizontal scan body, it's a vertical scan body. And so the lab, the 3Shape lab software, or whatever software you're using in the lab, or your lab is using, it picks up the top of it, not the wings. And so that's, I guess, one of the really nice things. So you can use and abuse your wings, so to speak. So we'll just quickly bond those together. Surely there's a shield in the house, but that's okay. Just quickly bond that together. Like so. That's gone down into the holes, which is what we want. Again, just curing those much more effectively. That'll keep that all together. We'll go with that. Okay, so our next thing, now I'm using the upper scan selection to scan this. So it doesn't matter if it's upper or lower, it's irrelevant. When the lab gets your scans, they don't care if it's upper or lower orientated. They don't care about that. What they care about is it usable? And so in full arch scanning, you can just keep adding cases, just keep going, giving them more and more information. They can just keep overlaying things and increasing their accuracy and in the integrity of the data. So again, now what I want to do here is I want to scan. I want to go over and pick up the landmarks that I did in my pre-scan. Does that make sense? So I'm really tempted to just go straight over the top of the tectonics and just go, oh, yeah, cool, that's good. Locked all that into position, that's good, and then send it. Like, I'm really tempted to do that. And we do get that. I mean, I'm sure labs get that a lot. But if you've already done a really nice pre-scan, help them out and get some more mucosa, get some more information so that they can overlay. Let's just keep going. And again, I'm just going to run up here. Roll over. And again. I switch my grip quite a lot. I go forward and I go back, and it just really helps. All the time I'm supporting the scan ahead with another part of anatomy. So I've got my thumb here, I'm resting here, I'm rolling, just getting all this information. And that's it. That's pretty much it. So that goes off to the lab. They overlay, you do your bite registrations. They digitally now can put that into the system, and you'll get back a restoration, whether you want to put them, click them on and let the lab put your housings in the dentures, or whether you want to send them away to get reinforced casting inside that denture, or whatever it is that you're doing. You've now got all the information to do that. Or whether you want to retrofit in the mouth, which is actually my preference. I do prefer that. They know exactly. So this file, this ScanCraft file, will create a model with the gap for you. So you've got a nice big gap, and you can even ask for a drain hole if you want. I like drain holes. And so does that all make sense? I mean, we've done a lightning look at this. It's quite a complex topic, but I hope it just gives you, opens your mind to the possibilities of the systems that are out there. And like I said, there's many systems out there. This is a great one that I love, but there's other stuff out there, and you just really need to jump into this stuff. And that's what we've learned throughout this entire series, is that you just got to test. And I know it's not always possible. You've got a live patient. I was very fortunate with my role that I could, and I say this all the time, I had a lab credit card, and I could make 3 restorations for the same patient back in my older evolution iteration. And so what I was able to do is just to test everything. And so you may not have that complete flexibility with that, but hopefully I've made a lot of mistakes that can help you out as well. But I hope that that's helped you. Joe, I'll just get you back up here, and we'll close off now. And any questions we will take. Sorry guys, we won't have questions online tonight, but we'll be doing that live in the studio audience as well. Thank you.